I am delighted and honored to be presenting through Touch a Life Foundation's fabulous World Kindness Day celebration and this platform. Thank you, Tej, Sai, and the entire TAL family. Before I start, let me share a little bit of a background about the origin of TAL and how I came to be involved with the project. I remember receiving an email from Tej when he was still a high school student. All he wanted to do was us to support his fundraiser, which was going to bring enable education for kids in his neighborhood, bring them education supplies, backpacks, and socks, so that he could get them out of their current circumstances and support their education. I remember thinking, what a kind heart inside this young man, this young teenager, and his bias towards action, that he wanted to do something about that terrible, terrible situation. Fast forward to present time, when we see TAL, that it has grown as a platform. It is supporting many, many endeavors in cash, in kind, through services, particularly through this pandemic. Tej, your basic premise for existence of TAL, or Touch a Life Foundation, has been proven, and there exists a strong need for doing good by connecting people who want to do good, and where they can influence through their kindness. So kudos, Tej, you make us all very, very proud. And today, I'm really excited to shine the spotlight on one of United Nations' top SDG, or Sustainable Development Goals, namely good health and well-being. As you can see, this is goal number 3, and we are kicking off the discussions around good health and well-being, healthy living in mind, body, and soul. I'm going to take you a little bit of a background journey, because since 2003, 2004, this has been the world that has consumed me completely, eating, sleeping, drinking, whatever it was. I was constantly thinking about health and well-being. I was a new mom back in 2003, 2004, and was trying to balance the increasing responsibilities, in both my personal life, and the realization that going back to work was simply not going to make me terribly happy, because the job was burning me out on both ends. I wasn't super excited about going back to technology projects, because it was not essentially a meaningful work to me. I do not know what transformation had happened to me after I became a mom, but I really wanted to identify areas where I could have an influence and an impact. I found myself identifying underserved segments of society right inside and around my own community, where we were living, and these segments were facing challenges with regards to recognizing a health problem and doing something about it. And as a problem solver with an entrepreneurial mindset and analytical mindset, being an engineer and working in technology, I just dove right in. It was the starting point of my new career. Hindsight is 2020. And I remember suddenly, I was staring point blank at interconnections that were not readily obvious at the time to others. And I have to be very honest, it was not a particularly eloquent or articulate problem set and a solution for myself as well. It was like an electron cloud, and the orbiting paths still needed to emerge. And I'll elaborate upon that in a moment. So that journey led me to identifying a whole new industry and a set of possible solutions, alternatives, and modalities of delivery of those solutions. The industry I'm talking about is that of brain training. Prior to that, these were two words that were not used in a sentence together. The Brain Studio was born in 2005. And since then, I like to say that we've been keeping brains alive since 2005. It's a purpose-driven, pioneering cognitive training startup, which was based on extensive neuroscience study, user research, immersive market trends understanding, talking to people, and the analysis of their needs. Our mission has been to change the world one brain at a time. Let me move over to the next slide. The World Health Organization defines health as a state of, and I'm reading, complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. But for many Americans, the WHO goals or definition of true health seems unattainable. It has been like that for many years now, given the multitude of complex health problems across the board, across the spectrum that people in communities face, and that the focus has always been on solutioning through curative means rather than prevention. You will remember that in the last 15 years or so, suddenly the mass media has been bombarding us with imagery of the brain. And we can't help but learn a lot about our brain, partially, completely, correctly, or sometimes incorrectly, through these images. But definitely the campaign of the mainstream media and the chatter has definitely left us more knowledgeable about the topic of brain, the need for its health, things that need to be done to keep it healthy, and why it is important. So, the war in the Middle East and the injured vets arriving back to US shores helped put a huge spotlight on the area called TBI, or traumatic brain injury, and PTSD, or post-traumatic stress disorder. These have been two grave outcomes of war with heavy toll on human well-being, both at an individual level as well as families and communities. As the slide shows, up until then, the medical science had been treating brain injuries through clinical interventions, focusing primarily on rehabilitation to physically measurable outcomes and performance standards of the brain, and the capabilities of the brain. Without exception, the nature of injuries to the brain have far-reaching effects that last longer than the simple clinical interventions that are given to people who are suffering from these injuries. I refer to such injuries as fractures of the brain, and I don't take that term lightly, because I have had multiple fractures of the brain myself during my teenage years. As a fully recovered TBI patient myself, I'm intimately familiar and understanding and empathetic of the problem from the inside out, rather than just the dimension of knowledge from textbooks and labs. As we continue on the TBI and the brain path, I'll show you in a moment why I'm taking you through the journey of brain when we're talking about mental health, precisely because as you can see, the mental health understanding was limited to depression, anxiety, and treating these conditions with drugs, therapy, and coping capabilities or counseling, rather than anything that would supplementally impact the outcomes of mental health rehabilitation from the outside in. So I want to illustrate that mental health as we know it today was in its nascent stage, because there was only limited categories of the spectrum of mental health that was recognized, accepted by individuals, or even help interventions were sought by individuals, let alone entire organizations on behalf of these people. So the accompanying stigma was used to be high, and things were more hush-hush than being out in the open and fully supported the way it should be. However, and around this was the time also that the Brain Studio innovated to bring non-clinical interventions to the table. I wanted to help people in my communities push beyond the myopic sick care and focus towards WHO's true vision, true health vision, by creating a health system that integrated medical care with prevention. So as you can see, we put together a 5-pillar circuit, which we call the 360-degree circuit for brain and body wellness. And we endeavored to combine, we were audacious enough to combine brain health along with physical health by putting the brain on the treadmill and establishing connections, outcomes, and metrics that would help establish our hypothesis that physical health is necessary to influence brain health outcomes, along with things like diet and nutrition, sleep and restfulness, yoga, meditation, and spirituality. So the focus that we brought, along the same trajectory, Brain Studio was evolving into a wellness studio as well. As a result of speaking with hundreds of clinicians, doctors, occupational therapists, we were talking to nurses, we were talking to physicians, case managers, and psychiatrists, along with hundreds of people who were willing and able to talk about the first-hand problems that they were facing, whether it was post-traumatic stress disorder. I was working with vets at the time, was working with ex-NFL players with brain injury at the time, to get insight into what they were facing in terms of available support and therapy, and what more can be added to supplement what were very important support systems that were missing at the time. So the Brain Studio and our wellness center was trying to fill in those gaps by becoming a valuable player in the journey of the patients towards complete wellness. So I'm showing here in the graphic, it took us a couple of years to analyze these data points, these interviews, these results from all of the stakeholders of the ecosystem that was starting to emerge, because we were looking at a 360-degree view of what were the influencing stakeholders in creating that ecosystem. We were synthesizing those results and then publicly trying to deliver a mechanism that could be supported by our immersive anthropological research. What I'm trying to say is that the culture was evolving at the same time that the available research that was being disseminated among people was also evolving and being lapped up. So I have to share with you that when I used to present, talks around brain fitness, what it is, why it is important, how can we keep it be accomplished, and so forth, to groups of individuals, from 5 to 300. That was the maximum crowd that I used to be talking to and getting their feedback from. In the beginning, 100% of the people would raise their hands and say, nothing can be done about the brain. You use it, or you've lost it, and nothing can be done to rehabilitate or prevent the downward spiral that brain injury or brain atrophy or cognitive decline is bringing. However, today, or even 5 years ago, the entire thing had shifted. People were not raising their hands. People were educated. People were aware that something could be done, and and that's why they were equipped, empowered to becoming more proactive about, taking available services and supplemental activities into their own hands, so that they could take charge of their own brain health and mental wellness as well. So I'm just reading from here that a paradigm shift was starting to happen on a deeper scientific understanding of the brain, which was concurrent and with acceptance of the mental health. That's precisely the point that I just elaborated. For the first time, brain health and mental health were coming together to form what we now know today as the wellness industry. As you can see, factors affecting mental well-being were being studied in isolation, whether it was biological, psychological, and social. But now, in the last 10 years or so, the factors have coagulated and come together, so that we are not treating brain and mental wellness or wellness industry in isolation, but they have influence over each other, and it is understood, measured, and implemented across the board, which is a great thing for our people and communities. So I'm just wanted to show off a little bit by showing you that we actually created location-based, brick and mortar-based wellness studios and scale it to multiple locations. I'm also very, very proud to say that back in 2016, there was a truly public-private partnership that happened between our wellness studio and the local government in our counties. We created what is the country's first ever brain health expo, which brought together, neuroscience research and medical fraternity from various specialties like nutrition, sleep, neurologists, etc., right alongside non-conventional modalities like yoga and meditation, and many, many more. So brain health expos are now held across the country, across cities every year, and have been instrumental in making mental health and mental wellness industry mainstream. Very proud of this accomplishment, and I really wanted to share with you. As you can see, our work has helped bring about a definitive social impact on participants under our care, from cognitive decline to neuroelasticity. We were able to influence, the numbers speak for themselves, thousands of people, tens of thousands of families, creating a cumulative social impact, a spiral effect, so to speak, by persisting, establishing credibility, whether it was with universities and colleges. We even created supplemental internship and field study programs for students across multiple disciplines, whether it was occupational therapy, physical therapy, cognitive therapy, yoga, and athletic training, so that the new generation or new batch of students could see how everything was interwoven, interdisciplinary, and they would have benefit of participating in our work and take that to, when they're ready beyond college to their individual workplaces. So we had, I'm very happy to share that we had a really big social impact on almost all the stakeholders that were involved in development of our wellness programs. So now, if you fast forward from the journey of bringing brain being in isolation and mental health being less understood, to this full flourishing of the wellness industry where everything is working hand in hand, let's focus on factors that affect employee well-being. So there's professional health, of course, there's mental health, there's family health, there's financial health, and there's physical health. In the last few years, I would say last 5 years or so, organizations have definitely taken steps to focus on employee well-being. They're offering perks like, you join the gym, or there are talk therapies that are available, telemedicine has been made available, and so forth. However, national surveys reveal that there's a way that the organizations feel that they are catering to their employees' well-being versus how it is received, perceived, and believed among the employee fraternity, how the organization is supporting mental health at workplace. There's a disconnect. But you know what? Not all is lost. We are making great progress at high speed, as you can see. Just like an individual, if anybody has or of someone who have mental health concerns, people are typically, we all go through a journey of denial to acceptance. And then once we are at an acceptance stage, then, the tide turns upwards and we start to actually do something about that acceptance, about that situation, find support, find, activities and solutions that can bring us hope and put us on the path to improvement. So pretty much like that, the whole ecosystem of the medical and supportive services has and the widespread culture has been going through this kind of a turn upwards. Particularly, I would like to say that today's workforce is vastly different from the workforce of 10 years ago. So the challenges are almost, even though the challenges remain the same, in spite of these challenges, the good news is that the world at work is vastly transformed by all the awareness, much like individuals, that deal with a depressive state, like I showed you. So in the last 5, this is a research report from 2014, 2016, and as you can see, mental wellness has attracted some of the greatest amount of intellectual capital investments, passion, as well as very high expectations and anticipations in the last several years. What's going on is that there has been rapid research across multiple domains, whether it is wearable tech, drug discovery pipeline, IoT devices, and AI-driven automatic solutions, mobile healthcare, and so on. This is the Gartner. This is a traditional Gartner digital health hype cycle chart, and as you can see, everything is across different buckets. From idea or concept through proof of concept, through acceptance, and promise of getting us to a solution that can be mass marketed, commercially made commercially available, and bring valuable sustenance to mental health and mental well-being. So all the above, whether whether or not people were making progress and people were tuned in to what were the advances that were going on in the mental health and well-being industries, the last 2 years of the pandemic has really done a number on the mental health of adults and across the board worldwide. So as you see the numbers here, we can't treat the pre-pandemic data points and numbers same as what has happened in the last 2 years. What has happened in the last 2 years actually works to our advantage. That there's not a very small percentage of people, I would have to say that people may be living under the rock, who may not have felt the emerging need or the changes, in their well-being, in their mental makeup, or people around them. So we have become really enlightened about the distress that the pandemic has caused, and the acceptance and need that, yes, this is a problem. Yes, it is a problem that is not just with myself, maybe people around me as well. I need support and I can offer support. People need support, and together we can support each other. That we have all, many people have responded that they are trying to treat their mental health challenges by binge drinking, or taking prescription drugs for non-medical reasons, or even using illicit drugs. So what that doesn't augur too well for the society. So it is imperative that the employees, a significant number of adult population spends a significant amount of daily time at workplace or with colleagues interacting. So if we help create an environment that is accepting, that is offering sustenance, that is offering mental health and well-being to our employees and colleagues at workplace, then it will be a phenomenal transformation, a phenomenal support system. Let me show you how transforming it has been for the workplace today and for the workplace that is being designed today for future. I want to show you some new research that is that is coming out from Harvard Business Review, or leading research, NIH, for example, National Institute of Health. A real corporate strategic imperative is emerging at the CEO level, that well-being is not just a benefit, within an HR department. An entire vertical or a function is being created across organizations, where the companies are creating line items and budgets and P&L responsibilities for well-being, creating roles like directors of well-being, well-being managers, and chief health officers. That shows how much commitment is happening, across the board, in order to respond to this very vital area of human resource. So I titled the slide saying, we are putting the human back in human resources at workplace. So the organizations are taking it very, very seriously. In addition to creating those, what can employers do? So I was reading a report on the McKinsey website. So organizations are making mental wellness a priority by dedicating resources, leadership focus, and expanding resources for employees at the workplace. So they're creating enhanced mental health support. They're making sure that the communication is available, telemedicine is available, counseling is available, cultivating an inclusive culture. People understand that there need not be any stigma if somebody is having a down day because of certain challenges at home, or because we are all dealing with different situations. There may be a reason for people to not share, but if we find something and if we speak up, and we are equipped, there is training that and upskilling that is happening to equip people with the right skills, how to talk, how to broach the subject, how to make people feel included, and help them feel a part of the social fabric that we are helping cultivate at the workplace itself. So measuring and holding people accountable for the wellness, whether you are at a line team member level, or rising up the ranks. We all would like to have good days and be instrumental in enhancing and offering good days to our peers and our subordinates. So what is going on in the industry? As you can see, digital health tech, life sciences, and biotech innovations are happening across the board in the last 5 years. So we have, as I was showing you through the Gartner hype cycle chart previously, there are early successes and there are high potential items that have kind of funneled and bubbled up through all of the research that has gone into creating and the investment that has gone into building out this vast ecosystem of products, services, and a combination thereof. As you can see, there's a peak interest in online therapy. There's a peak interest in online symptom checkers and diagnostics, because for the most part, people would like to first identify a problem, be independent in identifying and diagnosing, trying to manage things at their individual level, in the comfort of who they are, before going to wearable devices and things like that. So right now, the wearable tech, or IBM Watson Health, or blockchain in healthcare, are kind of not quite up there, but there are high potentials that are emerging. Last but not the least, the biggest authority, like as I mentioned previously, National Institute of Mental Health, it has put its stamp firmly, and it's amplifying the message that according to its strategic plan goals, they want to define the brain's mechanisms underlying the complex behavior. There's the Human Genome Project. A big portion of that research and resources are going towards understanding the brain connection with behavior, and providing solution and insights and solutions into finding critical care at the moment of need when it is needed. Also, people are, the researchers trying to study how does mental illness traverse the trajectory of a person's lifespan across the lifespan, whether it's childhood, teenage years, understanding how it evolves, ebbs and flows, grows and subsides, or does it, feed into itself and spirals out of control? So what are those critical moments of this trajectory where interventions can be provided so as to ensure greater well-being as far as possible, and wherever we can influence? Certain things, in biologically speaking or chemically speaking, may not even be possible to intervene and influence outcomes. For example, if somebody has had a traumatic brain injury, it will be treated very differently than the mental illness that accrues. For example, once someone has had a surgery, or they are living by themselves, or they have very little social engagement. What are the things that we can do to bring them out of that situation? What is possible and what is not possible? Defining that as part of the game plan is a very important strategic goal for NIMH. Also, as I mentioned previously, we are shifting from only cures, which are after the fact, to prevention, so as to prevent or at least delay certain inevitable health situations, as a person grows through their life trajectory. Last but not the least, NIMH is also strengthening the public health impact of the research and making sure that these research data points are made available to up and down the value chain, the ecosystem of healthcare providers, case managers, and so forth, so that the goodness and the cheer can be spread, and positive outcomes and it can be influenced. So I think I covered a lot of ground over here, bringing you with the journey of brain fitness, brain training, and mental health and wellness, which pretty much also sums my 16-year journey so far, being the founder of the Brain Studio and continuing on this path myself. It was not easy. We pivoted a few times. I was burnt out and fatigued at least twice. I remember, when I just wanted to give up. But the passion of wanting to do something good and making an impact, particularly because I feel enlightened about the topic, through my own personal experiences and successes, I felt that the giving up is not an option. So I'm just still pushing forward. It's just that now the brick and mortar model was not sustainable and scalable. We did scale to 8 satellite locations, thus thereby increasing our reach to thousands of people. But that, we find, particularly after the pandemic, I feel that pivoting to a more technology platform-based solution will be the right thing to do, so that we can maximize our learnings and employ technology to expand at a massive scale. So with that, I would like to conclude my presentation today. I want to wish you luck, wish you well-being. I want to wish you health. And particularly from the Brain Studio, what I would like to say is eat smart and unlearn. Make sure that you give your brain the cerebrity treatment. Thank you very much and have a great day.